Hey everyone, welcome back. We are in chapter 11, slide 13. We are continuing our talk about axial muscles. We finished talking about muscles of facial expression, muscles of mastication. Now we're going to talk about muscles that position the vertebral column, muscles that swallow, and also muscles to help you breathe. There's actually a ton of muscles that help you swallow. And I'm not going to have you know for this class the names of every single one of them. What I would like you to know, let me point them out right here. In this anterior view, we can see that some muscles are attaching here, up from the tongue and the throat area, and off to the side here, and over here, back here, and also down here. What all these muscles have in common, besides being in the cervical region, is that they're attaching to one of two things. The hyoid bone, remember the hyoid is right here. Got the two lesser horns and then the greater horns of the hyoid. It's floating, and by being floating, it allows for a lot of mobility, and you need a lot of mobility for tongue movement and for swallowing. Similarly, you have your thyroid cartilage of your larynx located here. Most of the muscles for tongue movement and swallowing are attached to one of these structures, the hyoid and the thyroid cartilage. So I'm not asking to know the name of the muscles for this particular action. I want you to know what they're attached to. They're attached to the hyoid and or the thyroid cartilage. It's high mobility and a broad surface area for this thyroid cartilage of the larynx for swallowing and for tongue movement. Talking about neck movement, we have two major muscles for neck movement. The sternocleidomastoid, it's a fun name. Sterno because it's attached to the sternum. Cleido is referring to the clavicle. Mastoid, it's attaching to the mastoid process, which is part of the temporal bone. You can see it attached here along the lateral, in this lateral view. That's the sternocleidomastoid. It's an important neck muscle here. Since it's coming lateral and a bit anterior, it's important for flexion, for lateral flexion, and for rotation at your cervical Z joints. Flexion, lateral flexion, rotation. Your trapezius is more visible from a posterior view. It's this very, very large muscle attaching at the base of the occipital bone, all the way down the vertebrae and to the scapula. That's just one, and then you'd have the same thing on the other side. Trapezius, trapezoid shaped. It's an antagonist. It's for extension. It's for extension at cervical Z joints, and it's for also elevating your acromioclavicular joint. That's actually, we'll talk about that in the next chapter, but it's an antagonist of the sternocleidomastoid. It's for extension, while sternocleidomastoid is for flexion. Now, when it comes to breathing, the major muscle of breathing is the diaphragm. The diaphragm is this broad, flat muscle. In this picture at the bottom right, just so you have an idea where we are, you can see the sternum right here. Cartilage of the ribs and the ribs themselves are coming along this way. Vertebrae in the back. The diaphragm attaches all along these bones, sternum, ribs, vertebrae. And the fibers extend, they radiate out. Very large, flat muscle. It separates your thoracic cavity from your abdominal pelvic cavity. And when it flattens out, when it gets flatter, that's how you breathe in. Air flows in to your lungs when it flattens out. In other words, it's depressing and pushing down on your abdominal pelvic cavity. You're increasing the volume of your thoracic cavity, causing air to flow in. When you do normal breathing, it's called quiet breathing. When you quiet breathe, you're breathing only with your diaphragm. Diaphragm contracts, diaphragm relaxes. You breathe in, you breathe out. Diaphragm contracts, diaphragm relaxes. You can use other muscles to breathe, though. If you want to forcefully breathe, you want to breathe in more, you need to use more muscles. The muscles to breathe in harder are the sternocleidomastoid. Remember I said it's attached to your clavicle and sternum? Well, you can pull up on them, you can elevate them, increase the size of your thoracic cavity, and therefore breathe in more. So the sternocleidomastoid also elevates your thoracic cavity, elevates your clavicles and your ribs. You have muscles in between your ribs. The external ones in between your ribs, the external intercostals, when they contract, they help you breathe in. They elevate your thoracic cavity. And then, of course, the diaphragm. It doesn't elevate the thoracic cavity, it depresses the abdominal pelvic cavity. So those three, as well as the scalenes, which we're not going to discuss, but those three are for breathing in. Muscles of inhalation, because you're elevating at the sternocostal joints, the joint between the sternum and the ribs. You have muscles in between the ribs that are a little bit deeper than the external intercostals. Those are the internal intercostals. Compare that with the external intercostals. The internal intercostals do the opposite. Rather than elevating your sternocostal joints, they are depressing your sternocostal joints. So you're collapsing, not fully, but you're making your thoracic cage smaller. That causes you to breathe out. Your abdominal muscles, we'll go over all the four different types, but your abdominal muscles compress your abdominal pelvic cavity, so air is forced out. So that is also for heavy breathing of breathing out. You know that your abdominal muscles are good for breathing when you laugh really, really hard so much that your stomach hurts. Your abdominal muscles are getting sore from you forcefully breathing out, forcefully laughing so much. I said that there are four abdominal muscles. Here are their names. The ones that you might be most familiar with are the rectus abdominis muscles. Those are the ones that form the six-pack or eight-pack, or just, they're hiding underneath whatever you got. It's all good. It's got that shape when you do see a six or eight-pack because there's tendon pieces in between. So you can see tendon running along here, connecting these sections. It's fairly straight and it's fairly superficial. You have external oblique muscles. External oblique, the way that the fascicles are oriented, they go inferomedial. That means they go down and in. I should have mentioned rectus. Rectus means straight. So they're just going straight up and down, the fascicles. External oblique goes inferomedial. Internal oblique, if you look, it's a little bit deeper to the external oblique. They go superomedial. Again, you have to imagine that if this is the midline, there's a difference. And then the transverse abdominis is the deepest one, and its fascicles go horizontal. So you have the rectus abdominis, it's very superficial. Then you have the external oblique, the internal oblique, and transverse abdominis, 3 layers of muscle. Those are your oblique muscles. You have 3 layers of oblique muscles. External oblique, internal oblique, and transverse abdominis as oblique muscles, they help also with lateral flexion, not just flexion. I don't think I mentioned this, not only flexion of the lumbar Z joints that helps you do a sit-up, helps you do a crunch, but also they help with lateral flexion. All of these muscles are held together by an aponeurosis. I should make this plural, abdominal aponeuroses. You see all this white stuff here connecting the muscle? That's abdominal aponeurosis. You can see the aponeuroses if you look at the bottom picture. This is a cross section. Take a slice through the abdominal muscles. If this is the anterior side, over here is posterior. So this is inside of the abdominal pelvic cavity. Here's right lateral, here's left lateral. Rectus abdominis is right here. External oblique is right here. Internal oblique is right here. Transverse abdominis is the deepest. In between all of that, which I'm going to color in green, is tendon, holding it all together. That tendon is abdominal aponeuroses. Aponeuroses. The very, very center line of it all, and that line that you see, the midline of your abdominal muscles, that's just tendon. There's no muscle at the very, very, very middle. That's known as the linea alba. Alba means white or light. Linea means line. Linea alba. It's the aponeurosis middle line structure. Now, when you think of flexing your lumbar Z joints, you think of these muscles, the abdominal muscles, rectus abdominis, external oblique, internal oblique, transverse abdominis. But there are other muscles that help you, and they're really deep. So this is, whoops, these are fairly superficial. If you remove all of this, remove all the organs inside of you, sorry, slide 18. So the intestines should be here, but we've removed them. You can see the vertebrae, you can see the pelvic bones, or sorry, the coxal bones of the pelvis, sacrum and coccyx. This muscle here connected to the lumbar vertebrae all the way down to the lesser trochanter of the femur. This is the psoas major. This is pronounced psoas, has a Z sound, psoas major. And then this muscle that also attaches from the iliac fossa down to that lesser trochanter of the femur. This is the iliacus. Together, the iliacus and psoas major, they work together to also flex the lumbar Z joints. They're known as the iliopsoas. You have the iliacus and the psoas major. Whoops. They both insert at the lesser trochanter of the femur. They also flex your femoral acetabular joint. We'll talk about that in the next chapter. But psoas major, iliacus, the iliopsoas group, they work together with the abdominal muscles to flex the lumbar Z joints. So these are all muscles for flexing the lumbar Z joints. How do you extend? How do you maintain posture? You need muscles on the other side. These are all muscles on the anterior side of your body. We need muscles on the posterior side. The major muscles for this are the erector spinae group. Spinae, that's what S-P-I-N-A-E, that's how it sounds, spinae. Erector spinae group is a group of muscles. I'm just going to group it together for you. I'm not going to have you know the individual ones, but you can see them highlighted here. They're very long and parallel, going all the way up and down your back, your dorsum. By attaching to the vertebrae and to the ribs in the back here, all the way up and down, they can help you maintain your posture, extend your lumbar Z joints, your thoracic Z joints. You can extend with your trapezius muscle, your cervical Z joints. They can also laterally flex. So in that case, if we're talking about lateral flexion, the erector spinae group can work together with those oblique muscles, the external oblique, internal oblique, and transverse abdominis. Not only does the erector spinae group help you stay erect, help you stand up straight, you have these large, broad muscles on your back, the latissimus dorsi. Latissimus dorsi, it inserts to your humerus, actually. We'll talk about how the latissimus dorsi also helps with actions like rowing and doing pull-ups. But because of their broad attachment on the back, they help you stand up straight. They help you extend. Both of these muscles are connected to this connective tissue that attached to the iliac crest and to the sacrum. This is known as the lumbar fascia. Lumbar fascia. It binds these muscles to the spinous transverse processes of the vertebrae and the sacrum. So that wraps up our chapter, but I will go over these muscles in complete anatomy. Something that I will ask you to do is to identify how, like, different muscles used for these different expressions or different movements. So if I show you a face like this one here, you can see that he's using several muscles. His forehead's wrinkled, so his frontalis is being used. He's smiling, so his zygomaticus muscles are being used at minimum. Facial expressions are complex. So are movements. Any movement of your body can be complex. It's usually a number of muscles that are helping you move a certain joint. So we'll be practicing different activities throughout the week of how to decipher which muscles are used in which actions. Let's take a look at that complete anatomy again and look at the different muscles that we just discussed. I want to reiterate that this model that I've linked you to only shows the muscles I'm asking you to know. There are more muscles in this, but we're not going to go over those. So the sternocleidomastoid, let me hide the platysma. Platysma is superficial. I'm going to hide it on one side. There. And now we can better see the sternocleidomastoid. It's actually two things. Let me multi-select. There. There is the sternocleidomastoid. Look at how it attaches to the mastoid process of the temporal bone. The sternum and the clavicle. That's how you get sternocleidomastoid. Sternocleidomastoid, but put together as one word. For flexing and lateral flexing of the cervical Z joints. We have the trapezius, which is a very large muscle in the back. You can see how large it is and superficial. It also has multiple parts, but we'll just refer to them all together. Let me actually isolate it this way. So it's only one part of it's being highlighted, but this whole thing is the trapezius. You can see how it attaches to the vertebrae, the spinous process of vertebrae, the spine of the scapula, and the clavicle. So it's going to help with clavicular movements. We'll get to that next time, but it helps you extend your neck, extend your cervical Z joints. To see your diaphragm, we'll actually have to go deeper. So we'll look at that in a minute. But let's look at the abdominal muscles. So this tendinous sheath that's connecting all the abdominal muscles, that's the abdominal aponeurosis. Let me write that down. They don't call it that, but or plural aponeuroses. If I hide this on one side at least, now we'll see the rectus abdominis. That's the rectus abdominis. On one side, we'll go lateral. You can see the external oblique. If I hide this, now you'll see the internal oblique. So the internal oblique is deeper. There's internal oblique. If I hide this, now you see the transverse abdominis. So the transverse abdominis is deepest. I'm actually going to hide this and hide the rectus abdominis as well. And now we can start to see the diaphragm. Let me isolate it. You can see how the diaphragm wraps all the way around. This is what it looks like at rest. When you contract it, it flattens out. The diaphragm is the main muscle for breathing in. What you can also appreciate with those muscles removed and all the internal organs removed, you can see the psoas major on one side. Here's the psoas major. And then the iliacus, which sits in the iliac fossa. On the posterior side, again, you can see the latissimus dorsi. There's the right latissimus dorsi. I'm going to hide this. I'm going to hide the trapezius so that we can better appreciate the erector spinae muscles. There are several different erector spinae muscles. I know it says longissimus here on the side. That's just one of them. So it's a group of muscles. There's one of them. Let me highlight the others. Here's another one and another one. If you see muscles, the fascicle is going all the way up and down the back parallel. Those are erector spinae muscles, and they're fairly deep. You see I had to remove the latissimus dorsi, I had to remove the trapezius. They're going deep to these rhomboids up there on the upper back. Those are the erector spinae group. All right, those are the muscles of the axial skeleton that I'm asking you to know. In the next chapter, we'll go over muscles of the appendicular skeleton. Yeah, so let me know if you have any questions. Please leave questions and comments in the discussion or comment section. Talk to y'all later.